So welcome everyone to the second session of data management, choosing what works. We're going to spend about an hour and a half today with Allison and Kelly. Go to the next slide, please. This is just our funding disclaimer that the views presented by myself or the presenters today do not necessarily reflect the views or official policies of the Department of Health and Human Services or SAMHSA. Go to the next slide. Always, 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 if we want addiction destigmatized, we need a language that's unified. So we never want to describe someone as their disease or their diagnosis. We are always describing people as a person first. A few housekeeping notes. Today's presentation is being recorded and it'll be available to the public through a landing page where we collect all the recordings of all of our nonprofit basic learning series sessions. We really, really encourage you to join with your video on. It helps the presenters see your smiling faces, and we anticipate these to be very engaging sessions. If you're not speaking, remember to keep your line muted. And when you come off mute to participate, just identify yourself to help others recognize who you are. And feel free to submit any questions or comments throughout today's presentation in the chat. And like I said earlier, we will have opportunities to come off mute and just have discussion. And then at the very end of today's session, there will be a link to a short evaluation. It's an evaluation that goes directly to SAMHSA and lets you know if you find these trainings helpful in your day-to-day work. And I think that's my last slide. So I'm going to hand it over to Kelly and Allison. And hopefully everybody enjoys today's session.
Okay, well, thank you, Chris. So we have the three Kellys in the session today in the house. Anyway, it's good to see you all. How many of you were in the last session? So a couple of weeks ago, we did session 1. You want to raise your hands, put it in the chat box. Okay, I know Alaska was in the house last time. So hopefully some of you came back. Steph, I see your hand raised. Anyway, it's great that you're back. We're glad you're here. And because there are people that maybe were not in session 1, Kelly, we should probably do introductions. So we'll keep it quick. And I'll introduce Kelly first. So Kelly Milligan and I work with Allison Kelly and Associates. It's a small woman-owned business that I lead. And we have an amazing team. We work mainly in recovery and healing spaces. And so we were honored to be able to get the opportunity to do this session with you today. So Kelly Milligan is our senior evaluation lead for our entire team. I've known Kelly for about, I don't know, maybe we're going on 4 or 5 years, Kelly, a while. And she lives in Sacramento, California. She has a 3-year-old daughter named Liera and a wonderful partner. And Kelly, let's see, one thing I love about Kelly, I love a lot about Kelly, but I think the biggest thing about Kelly is that she's a really intelligent team member. She gives all of the work that she does like 100%, and she has just this tremendous work ethic and integrity. So that is Kelly Milligan in a nutshell. And Kelly, I will hand it to you.
Thanks, Allison. That's a hard intro to follow, but thank you. So I have had the pleasure of working with Allison, as she said, for several years. Allison Kelly has her doctorate in public health, so I'll do a quick intro of her. She lives in beautiful Sisters, Oregon, for anybody who knows where that is. A little bit outside of Bend, I believe. I've yet to be up there, but it is beautiful. She is the mother to a beautiful daughter named Caitlin. She's about 13 now, I believe. And Allison is an author also, so you can check her out at AllisonKellyAuthor.com. But she's written 4 books, some of them on a lot on program evaluation and public health and working in recovery and healing spaces. So I'm excited to co-facilitate. She's going to lead us today and I will support her. And I'm excited to see you guys all here. Thank you for joining us.
Yay. Okay. Well, we will get started. So thank you, Kelly, for that intro. Again, good to see you all here. We're going to keep it fun and engaging. So if you're hoping you could just like have the session on mute and not engage, then you might be surprised. But we want to talk about data management and choosing the right size approach. For anybody that was in the first session, we're going to review the homework. So maybe you did the homework or maybe you didn't, either way. We're going to talk about that. And then just review some data inventories, data management systems, data sharing, data confidentiality agreements, and then anything else you want to talk about. And this would not be a session without doing a Kahoot first. And so we're going to stop the screen sharing for a minute here and move to our Kahoot session. And the bad thing about this is we only have slots for 10 players. And so if you were in the Kahoot last time and you loved it, we want you to join. And if you didn't like it, then you don't have to join. And so Kahoot is an online, really fun game that kind of connects you all and all of us together. And it has some amazing music. And I'm going to put this up. And you can either do this on your desktop or you can do it on your phone, or you can just watch. So if you go to www.kahoot.it, that will bring you to this wonderful screen. And then you can enter the game pin, which is 686-6033. And we have 10 winner slots today. And we're just waiting for people to join the game. So we will wait until we get 10 people. And it looks like we've got Dr. Nick is back. I remember you. Juno Steph is here. Okay. Jen, love the football helmet. So we just need 6 more of you to join. And again, if you don't want to join, no stress, no pressure, but would love to have a full house of seats in this wonderful classroom. So we'll give it a few more minutes. We've got some different questions today, a shorter Kahoot. So for those of you who got a little bit tired of the last one, this won't be as bad. Okay, we've got Howell joining us. Okay, Juno, Steph, G Motion, and Jen. So 5 more people. What do you think? Okay, got a raccoon in the house. We just need 4 more people. I feel like I'm on a game show or something. And it looks like Dr. Nick is a baby, so perfect. Okay. And if you're having a problem getting on, let us know. We could help you. It's fairly easy once you enter the PIN. And Dr. Nick wants to know, should I only be seeing myself? Last time I could see others. Yeah, I think once we start the game, Dr. Nick, you'll be able to see other people in the room. But let's just check it out. So let's see here. Raymond, do you want to join? Or John? Or Haley? Or Alyssa? Daryl? Judy? So I'm just calling out people who are in the room who haven't joined. Let's see here. Who else? Angela, you want to join? Glad you have your video on. Jennifer. Okay, John is just passively listening today. Good to know. How about Alexandria? You want to join the game? Okay, well, I think we've passed the time of waiting. Oh, good. Kay joined. Love it. Let's just go with lucky number 7, and we'll get this show on the road here. So if you wanted to join but you didn't, you can still play along. We just won't record your answers. And let's see here. Let me make sure you can see my screen. Okay. Kelly, can you see the screen okay? Okay. So I want to know how you're feeling today. Are you feeling poor, fair, good, or excellent? There's no wrong answer to this question. So you just select one of those from your screen. Okay. We have people feeling good and excellent. I love that. Out of the 4 people that responded. So I'm glad you're feeling good, and I hope that feeling continues throughout the next 90 minutes. Okay. What have you done today for your health? I think that's so important when we work in recovery and healing spaces. So we want to know what you've done. Maybe you haven't done any of these things yet, but we would love to know. Okay, so spending time with loved ones was the big winner, followed by praying or meditating or exercising. All really good things for your health. Maybe you've done something that's not in the response option here, or you're not playing and you want to share. Put that in the chat box. We'd love to hear what you're doing in your lives to be healthy. And now we're kind of getting into some data management questions. Would love to know your role with and in data management. So there are 4 options here, and it might be that you're none of these, or maybe you're all of them. So just select the one that makes the most sense to you. Okay, so we've got a couple of researchers and evaluators in the house. Well, welcome. You're in good company. We love you. We love everybody. We have actual data collectors, and then we also have a supervisor and an administrator. So for the person that selected data collector, or that's their role, do you want to let us know who you are and what kind of data that you collect? You can also put it in the chat box. Okay, so Steph said data systems creator. Cool, okay. Anybody else? And Paul keeps on getting kicked out of the questions. Oh, I'm sorry to hear that. Kahoot is not perfect because everything is perfect and nothing is perfect. So anyway, I guess the big thing is that we all have a role in data management, even if we're not on the ground collecting it, or even as an evaluator or researcher. And so it's really something important to know and kind of talk about. We don't really have a scoreboard yet because these are not scored questions. And just a couple questions left. Which of the following statements is most true about data management? So what it means. Okay, so it looks like everybody got that question right. So good job. We've got a smart group in the house, and some of these other things are also true, but not the most true. And so I think we're going to have a really close game here. Let's see. How comfortable are you with data management, data inventories, and data use? So this is a question that gets at the heart of what we're talking about today. You can be 100% honest. That's the only way to be, right? Okay. Oh my gosh. So we have 3 people and they are very comfortable with all of these things. So the 3 of you, if you want to put your names in the chat box, we would love to know who you are, and maybe we can learn from you today. I mean, that'd be great. And then we have 2 people and that are not comfortable. So thank you for being honest. And then 1 person is not sure. So that's good. Glad to know that as we move into today. And the last question. Oh, I like this one. This gets at the why, and I don't know. I've got to know why. So why'd you show up today? And I don't know a lot about like your funding or even Chris's group. So you can be totally honest and nobody will judge you, but maybe you had to show up for funding. Maybe it was on your calendar and you had nothing else to do. So you're like, why not? Okay, and 4 people wanted to learn about data management. And 1 person attended the last session. They thought, why not? I love you, whoever you are. And then it looks like 1 person said it looks good for funding. So we have an amazing group today, Kelly. So let's look at who won. Okay, so we have a winner. It looks like, okay, number 1 is Dr. Nick. That is wild. Okay. And then we have some runners up. And I'm sorry for those of you who could not get in. Oh, and Angela, do you want to say something?
You know what? I answered all those questions. I was G motion.
You were
and I answered all the questions and it said I got them wrong or I got no points. I don't like this game.
You know, I am so sorry. I have students and they hate this game. They either love it or they hate it. So I get you, and I'm sorry that you had problems. But usually when it works, it's really fun. I don't know. I was telling Chris and Kelly, I went to the free version from the paid version. Maybe I told you guys this too. Anyway, so it doesn't have all the features. So I apologize if maybe that was why it wasn't working as well. But anyway, so we're going to get into data management now that I know we have a really healthy group of people who've exercised today and they've spent time with loved ones. We've got some attendees who are really comfortable with data management, and I can't wait to hear from you all. So anyway, this is a discussion. We have 90 minutes, so it's just kind of a teaser for what you can do and what you can know, and we're happy to help support you in the future if you have questions. So Kelly, I want to check in with you to see if you have anything you want to add or just make sure we're in a good space.
I don't. I think it's going well. Thank you.
Okay. And thank you for putting on your videos. I love to see Angela, Stephanie, Melanie. Let's see, who else has a video on? It looks like just you all. So anyway, oh, there's Daryl. Okay, Daryl, I remember you from last session. So glad you're back. Yes, absolutely. Okay. And then, okay, Dr. Nick says his connection might suffer. Yes, totally get that. So we're going to get into looking at kind of what we're going to talk about today, now that we've had fun with Kahoot, or not fun with Kahoot. So these are some things we hope to cover in our session, and we might cover more, or we might not cover all of these. We're just going to kind of go with the right, what feels right. And so, one of the things that Chris asked us to do was think about choosing the right size and the right approach for how to manage data. And we learned from you all a couple of weeks ago that we have different recovery organizations in the room. We have people at different skill levels and different capacities and different resources, and you're collecting all different kinds of data. And so it's important that you select what works for you. And I'd like to ask for one volunteer from the group. And it just to kind of talk about where you were at, because I don't know all of you. I'd like to know all of you, but I don't. And so maybe Angela, I know your video is working. You don't want to do it? You don't want to volunteer? Okay. How about Melanie Cobb? You look like you are ready to volunteer.
It's because this is so pertinent to where I am right now in our organization. So I'm desperate for this information. So I'm in Jefferson City, Missouri, and I run a recovery community center.
Okay. I love that you're here, and I love that you're running a recovery community center and that you need this. Because you are totally right, Melanie. It's like you don't know that you need this until you're in it and you need it. I mean, it's like it's kind of an afterthought. It's a weird thing that happens. So I want to walk you through these questions, and feel free to say like, I don't want to answer that, or I don't know. It's all good. So Melanie, why do you need to manage data? Like, that's the first thing I'd like to know.
We need to make sure that we're actually meeting people's needs.
Okay. And
so like quality assurance. We also, I mean, that's what I want to use it for. We also have, grants and things, but.
Okay. And how do you collect data, or how will you collect data?
So we're in the process of going from completely paper records to electronic. And so, but at this very moment, we haven't even picked which electronic health record we're going to use yet. We're doing demos and things, but so right now everybody has a paper file. We have an intake sheet that people do. We do a lot of talking. We don't have, scripts to do things. But we do everything that we help someone create, or everything that we do for someone. A note is written in their chart, but it's all paper.
Okay. It's all paper. And I love that you're right. Like, you're right at this crossover, because a lot of places are in this very spot. A lot of the clients that we work with are. So it sounds like you collect data using paper methods. And so where do those papers live now? Like, where are they? In a file cabinet in your desk? Are they in a folder somewhere? Are they all over?
So each person who comes into our center gets their own file, and they also get assigned to a specific peer. And so we have several peer support specialists here, and they each have their own filing cabinet. So finding a file is difficult sometimes. And then the data, like, let's say sign-in sheets, right? I have an office manager who handles all of our data reporting and compiles all of those kinds of data into her own spreadsheets for her own purposes, so that she can report our data as best as possible to our grant.
Okay. And so she might be using like Excel or something?
Yeah, she uses a lot of Microsoft Office.
Okay. So you've got some electronic record transition happening. So it's stored in these separate cabinets. And so how do you analyze paper data? Like, if you have 100, let's say, peers in your program, what does that look like with paper?
Non-existent or very time consuming. Like we recently, for example, needed to, let me just say, we decided to transport people to treatment and back, right? And so all of a sudden it's been like a year now, and we wanted to see how many of those people actually stayed for the whole time, or what was the barrier, that kind of a thing. Well, that requires going to every single person's file over the last year physically, and making the list of who all we took to treatment, and then trying to reach out to them individually, and then make a note in each individual chart if they actually completed. So it's just a big hassle.
Yeah. Oh yeah, totally been there. I 100% hear you. And so that's a challenge. And then what about data security, access, and protection? Like, how do you protect those paper files?
Yeah, so our grant, the good news is that whenever we got our grant, it enabled us to start according to some guidelines. So, we do have HIPAA, for we won't just share everybody's information or anything like that. And all of those go in those files behind a locked door, and all those filing cabinets are lockable.
Okay. Yeah. Well, and that's the good thing about, like, I don't know how many of y'all have like SAMHSA funding, but they require you to submit like the data management plan or your protocol for how you're going to share and store data and analyze it and all of that. So I think those are really nice kind of safety things they have in place, and they get you thinking about your data and what you're going to do. So Melanie, I am so glad that you volunteered to kind of share where you're at. And it sounds like you're moving into this electronic health record field. And there is, we mentioned it during the last session, but there's a beautiful document that was published on 3 different software systems that help you manage recovery data. And Chris, I don't know if you could put that in the chat box again, but I haven't used those, to be honest with you, so I'm not selling those programs, but it might be something to be helpful or to look at. And so thank you. And then we want to reward you for your time and sharing today, Melanie. So if you could message either Kelly Milligan or myself, we'd like to send you something for being a brave volunteer, being vulnerable, and sharing what you're doing.
Well, thank you.
Thank you. And so, there are lots of different ways that we prepare data and we interact with data. And one of the things that Melanie touched on was the protocols that they have for their peers and their peer support specialists, and how they manage those files. They lock them up. Each person has a folder and all of that. One of the things that's hard with paper data, though, is that analyzing it is, you almost have to enter it into an electronic database to analyze it, unless you're really good with math and you don't use a calculator or anything. I don't know. Some people are, but this is kind of a process of preparing data that we follow when we're working with clients. And most of our clients, like I said, are in recovery spaces or healing spaces. And we do a lot, our team does a lot with analyzing data, because we're all about research and evaluation. So we want to know what's working. So Melanie, when you talked about sending peers to treatment and then wanting to know how they're doing kind of a year afterward and going through all those files, you are putting your evaluator hat and researcher hat on. You're wanting to know the value of that treatment, what happened to them. So good job on that. You probably engage with data a lot more than you know, and are way better at it than what you think. So in the last session, we gave you all some homework. And if you were not in the last session, it's not a big deal. But we shared an example of a data inventory. And Chris, if you can put that in the chat box as an attachment, that would be great, just for anybody that wasn't here. But I'd love to see if anybody wants to share their data inventory. If you completed the homework and you're excited about your assignment and you want to get a gold star. So I know Daryl, I recognize several names from the last training. And I don't like to call out on people, but Daryl, did you happen to do the homework? Would you mind sharing your assignment with us?
I was a bad boy and didn't do the homework, but I can tell you that we're just like Melanie Cobb. Everything's on paper.
Okay. Okay. So, thank you for being honest, like, love that. And yeah, there are no people that fail this session. So if you're all in a good space, Daryl, and the thing about it is, like, if you are just dealing with paper and we are right there with you, like, it's your data inventory is really simple, because it's like, the data source is, an intake form, the name of the files, the client, the owner is you, the purpose is intake, and the location's a metal box. Like, it's a pretty simple process. And even if you have multiple forms and things like that, it's the same thing. So that's okay. Anybody else want to, maybe you have a different one. Let's see here. See what's in the chat box. So it looks like Dr. Nick shared some information here. And Amber, we have your hand. Amber, would love to hear from you. Do you have your data inventory?
Yes, so working with Daryl, he said we only do the paper stuff. I do actually track our files on a flash drive. So we do actually do this, and it goes even beyond this. We have date of the intake. We have a phone number so that we don't have to go search through closed files if we get a call. And so we really line out on that, and it's only accessible by senior staff and stuff. That flash drive has all of this information so that we can have a quick lookup of somebody who maybe comes back, or we have a subpoena for court because they want to make sure somebody showed up. We're able to access that via flash drive and just go pull the one file rather than searching through all the files. Does that make sense?
100%. Yes. I love that you're doing that. And so in that flash drive, so did you do the inventory, or do you want to share that or not? Is it all just in the flash drive?
It's all in the flash drive, and the flash drive is passcoded.
Oh,
That
okay.
way, if anything ever happens, say it gets left on a desk, we don't have a peer who can grab it and try to use it. It's locked.
Okay.
So I highly recommend that as well. But it has literally all of this information plus.
Nice. And so I bet it's important to have consistent naming on those files, or maybe a process of labeling different files in like a hierarchy, or do you have anything to say about that?
Yeah, so because we have multiple programs at our center, you might have the data source is the intake file, but the purpose is for reentry or it's for vandal recovery. And so those files look slightly different. So you need to know which program it's associated with. So our reentry intake file is different from the LRC intake file. And then vandal intake is altogether different from both of those. So because we have different programs, we want to know what it is that they're doing, because each program has different requirements on it. And so it might be an intake file. It might be that somebody came in and they did an alcohol base assessment. That's what's going to be the name of that file. And the purpose is going to be whichever program they're in. So it helps us link the program to the work that's being done, and all of that can be gathered up and then used to report for IROC, for instance, or SAMHSA grant funding. It's a really all in one location thing, and no one person is the gatekeeper. So staff can access. That way, if somebody is out sick or there's some kind of an emergency, state, Daryl, everybody can still get their information through another staff member.
Yeah. Oh, I love it.
I'm a huge believer in redundancy, always.
Yeah. Well, and so tell me about this flash drive, because it makes it like, I don't use flash drives anymore. I use cloud drives like Dropbox or.
Right.
But so does everybody have the same drive, or is there just one like under a gold key or something, or where is that at?
There is one flash drive. It is Velcroed in the locking file cabinet.
Okay.
So it can't just roll around in the drawer. It's Velcroed in there in the same spot every time, so staff know where to grab it.
Okay. And is that backed up on a cloud or anything?
No. Now the reason for that is we ran into a lot of HIPAA problems with the online avenues that we were looking at.
Mm-hmm.
We were going to utilize Faces and Voices of Recovery at one point, but because we were going in as a bunch of centers, I could access and others could access all client information. So I said no. That is why we remain a paper copy. We have not seen a really robust online tool that keeps HIPAA protected. Does that make sense?
Yeah.
It just, too many of them have too many loopholes for data sourcing in this. And I will not put the peer client's information at risk like that. I won't do it.
Yeah. Oh, I love your vigilance, and you're protecting your peers and being their voice and making sure that, you have a system that works. And what I'm hearing, Amber, is like the system that you work with, that drive and the Velcro and the cabinet it is like working for you, right?
Yes. Works
And
really, really well.
yeah. And that's all that matters. So thank you for sharing. We would love to send you something. So if you can send us your mailing address, you can put it in the chat box, either to Kelly Milligan or myself. We appreciate
thank you.
sharing. Yeah. And so that's a great example of choosing the right size, choosing a kind of a data management approach that works for your organization. So does anybody else want to share what they've got going on with their homework? It looks like Dr. Nick put in the chat. So they use an electronic health record. The name of the file is multiple. So the owner is his organization. Purpose is multiple, mostly data analytics performed by me. The location of the file is a relational database and secure my hard drive. Okay. Well, and that's another example. So when you have an electronic health record, it kind of manages your data for you. I know with one of the clients we work with, we have an electronic health record, but that electronic health record is not linked to other data management systems. So if you have, for example, any SAMHSA funding, we love SAMHSA funding, by the way. A lot of times you have to enter GIPRA data into SPARS, and we have GIPRAs that are uploaded into an electronic health record, and we have to download those and then enter those into SPARS because those systems are not linked. So anyway, there's some different things that are kind of going on with data management, different ways to do it. Anyway, we're going to kind of cruise on. If you did your homework and you have something you want to share, feel free to put it in the chat box or just chime in. One of the things that I will share with you is that our team uses Dropbox and Box a lot to kind of manage and store files and data. And so that might be something to consider. There's also Slack and Google Drive. And we had one of our associates kind of put together an analysis of those two different cloud-based platforms. And Chris, if you want to put those in the chat box, that would be really helpful. Just like if you're looking for a way to share kind of non-peer or protected information, and if you're a small organization or you don't have a lot of funding, wherever you're at, that might be something to consider. And
Ellison, which ones should I link in there?
we have two documents. I think one is called Slack Generic Overview. The other one's called Google Drive Generic Overview. Anybody in the house using Google Drive for any kind of data saving, data sharing? We have a lot of clients that use Google Drive, especially like in schools or rural areas. So Steph, you are using Google Drive. And Steph, it's good to see you again. Will you share with us just kind of what you think of Google Drive and how it's working for you?
Yeah, I use Google Drive as a great in-between. So yeah, for that data that isn't personal, doesn't have any personal information, I find its utility amazing. To be able to share folders and just have information dumps. that in a platform that a lot of people find quite accessible. And in I forget what it's an ecosystem, the Google ecosystem. A lot of people are familiar with it. So as a tool, I think it's really useful. Again, if we're not using it for people's personal data. I also find there in like Google's analytics that are embedded really robust, which makes going back to the safer platforms sometimes a little sad.
Yeah. Well, thank you for sharing that, Steph. And it looks like a lot of other people are using it as well. So Alexandria said to track responses to a community survey. Yeah, attitudes. Daryl said he uses it for backing up hard drives. I agree with you, Daryl, though. It is easy to get lost, though, when there's like a million files and a million shares, and you're like, where am I at? I've had that experience with Google Drive. So I'm right there with you. And then Alyssa said we use Google Drive and OneDrive. Okay, yep. And we also have an SFTP for PHI, protect health information. So Alyssa, do you want to unmute yourself and just talk a little bit about that process? Love to hear more on that.
Yeah, how we use Google Drive.
Or just the, like, what is the SFTP? What does that mean?
The SFTP is a secure file transfer program. So I am a TA provider and a data analytics for multiple RCOs within the state of New Hampshire. So in my job, I often have to send or receive PHIs outside of my organization. So if that is the case, I would use the secure file transfer to send and receive, which is like time limited and HIPAA 42 CFR compliant.
Okay, yeah, no, that's a really good example of how you're using a secure platform to share any kind of PHI, and then you also use Google Drive. So again, it's about choosing kind of what works and then also knowing your data. So Alyssa, I like that you mentioned that, like, you know, if we have PHI, then we're not going to just put it like in an email or on a Google Drive. Like, we need to, you know, make sure that we're handling it in a secure manner. So that's really helpful. It's good to know. Anybody else want to chime in on how they're feeling about different ways to kind of share data? If not, we'll keep going. Chris, yeah.
I just wanted to mention, and maybe there's just a connection that can happen offline, hearing Alyssa talk and hearing Amber's needs. I know, Alyssa, in New Hampshire, you use Recovery Link at the RCOs, I believe.
Yeah, so we've used a couple of different EHRs. I'm actually cited in that document that evaluates the 3 different electronic health records.
Nice.
Yeah, I was interviewed for that. We have used RDP, which favors electronic health record, and we are currently using Recovery Link. So we've used 2 of the 3 health records that are cited in that paper that you put in the chat.
So mostly to connect you with Amber and Daryl, that maybe Recovery Link is a better option if you can pull or secure an individual RCO's data, so you're not seeing multiple RCO's data when you go to pull information. I don't know if that's true or not, but maybe you all could put your emails in the chat and connect and talk about how that works for you, being you've used both systems.
Yeah, I'll definitely put my email in the chat, but both of those systems, RDP and Recovery Link, it all depends on how you structure your hierarchy, right? So I for example, we have an enterprise hierarchy. So I, as the TA provider, we have BAAs with each of the subcontracted RCOs. So like I can see all of the RCOs data, but the RCOs cannot see each other. So both of those platforms have that functionality. It just depends on how you set up the hierarchy. And
Perfect.
yeah.
Thank you so much.
Yeah, well, this is good. I'm glad that you all are connecting, and there's a ton of options out there. There's almost like too many. And then some other comments in the chat box, emails. Dr. Nick recommends FileZilla, Qualtrics. So there's some notes there. And also just like caution with Google Drive, which is really important. So again, choosing what works based on kind of where you're at. So we wanted to share with you some data inventories that we have worked in or we're working in now. And so let me see here if I can pull one up. And you know, one of the things that I was thinking about this morning is that we have like multiple programs within a recovery center. And so for each of those programs, they have like their own data inventory. And I thought, man, it would be nice to have a huge data inventory of all programs, but we haven't done that yet. So one of the things that we have done is kind of looked at, we use the medicine wheel and white bison a lot for one of our programs. And let's see here. Chris, if you want to put the data menu from Eastern Shoshone in the chat. Actually, it's right here. So this is an example of kind of a modified data inventory from one of the healing centers that we worked at. And it really was about understanding the overall like holistic wellness in the community and different data points. And then we pulled data from various systems to create this kind of data story. And I think we talked a little bit about that last time. Another example of a data inventory we worked on a few years ago with the OD2A CDC Data to Action project was looking at opioid data source inventories. And so this is another way of kind of thinking about data sources that are outside an organization that can be organized, and also thinking about the different strengths and limitations of each. And then I also wanted to ask Kelly Milligan to share a data inventory that she recently worked on with the Centers for Disease Control. And so Kelly, if you want to share that on your screen, that would be great. And then Chris, if you want to put that in the chat box, I think that has a little bit different title.
Yeah, it
and
should
so,
be.
Okay.
Yeah, thanks, Allison. Yeah, I'm happy to share this one. So we recently worked with a client on this, and so we kind of created a template for you guys if this is something that could support your work. It's a data inventory and management plan, so it is pretty comprehensive. This does stem from, it's a modified CDC template. So initially what we did is we worked with, I put and filled some examples from one of the recovery centers that we work with. And so we looked at kind of the different data measures that we're collecting, where you do for one project, specifically the Allen barriers to treatment form at intake, follow-up, and 12 months out. We do residential treatment outcome data. We do a residential treatment survey. And I know Dr. Nick mentioned Qualtrics as a tool. So that is something that we use. And we'll talk a little bit more about Google Forms in a minute. We do a harm reduction services data, utilizing Google Forms for all, of course, de-identified data. But this plan and this template's available for you guys, and it has kind of examples throughout. But it provides examples of kind of how you protect your data, any data use restrictions, how long you retain your data. Of course, that's always something that's really important. If your organization likely has policies around that, I know the one that I was working with, they can keep the data permanently, or they'll keep paper files for about 7 years. So it just depends on what your program and organization does. But then we also have kind of a data management and dissemination plan. So it really outlines kind of how Dr. Nick was sharing in the chat, where he was talking about, who has access, how it's stored, all of those different pieces. This goes into some really specifics of like the metadata, the privacy and confidentiality, who has access, how they access, if any data is published, how will that data be published? What would it look like? Who will it be shared with? So it's a really cool, just kind of comprehensive tool that you guys can leverage if that's something that supports your programs.
Well, I love that, Kelly, and I love that you shared that with the group. And so the idea here is that it's in words, so you don't even have to like export it from a PDF, but you can fill in the blank. So like think about what this looks like for your organization. And maybe you start really small with just one performance measure and one kind of fill in the blank for each section. And then it can grow as your organization grows. So again, there are like lots of different ways to think about how to manage data and what it looks like. And that is a really good example. So thank you for putting that together, Kelly. The next thing I want to do is talk a little bit about data management systems. And I wanted to walk you through a scenario of what we recently did with one of our recovery programs. And it's not client data, it's actually employee data. So I wanted to walk you through the process because it might help you in some way, or just think about the approach. And so with that, I'm going to stop sharing and I'm going to go to Qualtrics. And so we work with Doyanatsu Healing Center. They're out of Port Washakie and Riverton, Wyoming. They were previously Eastern Shoshone Recovery Center, and they changed their name. And their director asked our team to create an employee assessment. And it was required by HR, like every year, they were supposed to complete this assessment. And so we went back and forth on like what to include. And she really wanted to get at trauma-informed care, trauma-informed principles, and then things like, employee wellness and satisfaction. There were all different things in that. It's like, okay. So the first thing I told Kelly, her name was Kelly too, which is kind of funny. I said, well, let's do this online. And she said, well, that'll be fine. But she said, some of my team members don't do online surveys. They're older and they don't like them. And so I was like, okay, we'll have two different methods to collect data. So we went back and forth on what we were going to actually collect. And we settled on a really nice assessment, and I put it into Qualtrics. So you all should be able to see my Qualtrics screen now. And Kelly, can you see it okay? Okay, I never know because I've got a couple screens going on, and Zoom's always a little wild. So anyway, I put this survey into Qualtrics, and Qualtrics is actually a really nice way to kind of store data for a long time. I have some data I have from, I think, 2011 and a couple of different accounts. And so you can go back to your data if you want. You can also revise different data collection instruments you're using. And I just think it's the best program ever. And Melanie has to leave. Well, Melanie, thank you for joining, and we'll see you next time. So anyway, so this is Qualtrics. So we went back and forth, finalized the assessment, and then we created it. And I'm not going to walk you through like each section on how to add questions, but this was what the assessment looked like that we sent out. And it has some nice skip logic and other questions. It only took about 10 minutes for them to fill out. So we sent out an email, and we wanted 100% response rate. And it took about 3 weeks to get that, and also several follow-up emails. But we finally got it. And one of the really cool things about Qualtrics is that it analyzes data for you, and you can look at what people are saying like in real time. And so I'm going to skip that because it has some names, it has data, higher, but it gives you some nice bar charts, and you can even export these as JPEGs. It's just like the coolest software program ever. Anyway, so we got all these data, and we could even do an export here if we wanted to export the entire report into Word, and you could just do export pages and it would come up. So we collected that data, and then we put together a nice report of the findings that is right here. And it told us a lot about like where employees are at and where they want to be. And it also told us about their ratings on trauma-informed approaches. Like, do they feel that the healing center is really trauma-informed? And we can see that they're really high on creating a safe environment, kind of low on preventing secondary traumatic stress in staff. So that's an example of how we used Qualtrics to collect data. And this is a beautiful report we put together from that data, and we gave it back to them. And there are kind of a million different ways that you can use Qualtrics, but that's one of them. And one of the things that I really like about Qualtrics is that I feel like it's easy to use. I think it's free up to like 250 surveys. I might be wrong on that, but it's just something to consider. Like if you've tried Google Forms, maybe you don't like that, or if you want something a little bit more rigorous. And it has a lot of different kind of tools and protections and dissemination platforms that you can use that are, I think, unique to Qualtrics. So with that, any questions or thoughts on that process of how we use Qualtrics to collect data, to create the employee assessment and the report?
We used it, Allison, for a RCO survey process, and I cannot overstate how user-friendly it is, and all the amazing things I could do that was far beyond Google Forms and Excel once I pulled the data in different ways to display it. I'm a novice in this area, so I feel like I'm a good representative of a lay person throwing something together, not really knowing what I'm doing, but we got back really valuable information, and we were able to create some reports out of it. So I'm a big fan of Qualtrics.
Yes. Well, Chris, you and I should probably be salesmen for Qualtrics in the future. I don't know, just saying. Because yeah, I'm in it to win it. So that's one example. Like there are so many. Qualtrics is listed twice on this slide, I think, because we like it so much. But Kelly, do you have a Google Forms document that you can share? I just want to make sure like we're showing you all what we use, and maybe it'll spark something in you and you're like, ooh, I want to use that.
Yeah, I'd be happy to. So this one, as Allison, as we shared earlier, we work with recovery centers that manage maybe 10 to 12 projects or more. So they're collecting data a lot of the time for funders for their program. So it comes in a lot of different ways. So this client that we work with, most of their data that they collect are through paper. They haven't transitioned yet to electronic health record system. So in order for me to have access to their data, we found that we needed to probably create something digital for de-identified data that we could be able to report out to the funder, that both their project coordinator as well as I would have access to. So we could both kind of leverage that data. Their clinical director also has access to this data. So everybody can log in and see kind of what their program is doing, what it's looking like, what their needs are. So for this one, the program is called ROAD. I won't go into too much detail about them or this, but this allows them to track kind of their activities across that grant that we do have to report out. Most of this is done specifically for the funder, but the project coordinator identified different data indicators that are important to them as well. So we incorporated those. The nice thing is this kind of it's a very user-friendly tool. Again, only for de-identified non-public health identifiable data, but it allows us to track different activities that they do. So through this program, they do trainings. They have direct services through client interactions. This is a harm reduction project. They do harm reduction purchases that we need to report out to funders, and then outreach and harm reduction distribution. So this takes them through, you're seeing my version of the tool. Theirs, they would just select which boxes they provided a service for, and it would just directly take them to kind of infill information about that training or that client interaction. But what's really nice about using tools like this for de-identified data is everyone having access to the responses in real time. So recently they created a new partnership. So the project coordinator was able to log into this, pull the data that she needed out to provide to the partner who is interested in learning more about what the services are that they're providing and what has been most popular service that they provide. So it tracks a bunch. So it kind of gives them an example of, what are their harm reduction services that they're providing, mainly harm reduction. This has been in place for a few months. And it goes through what other services they're providing, or maybe what services they're not providing and have a need for. It also tracks different topics of training, education, just really anything that harm reduction service program is doing. It has info, and then there's a spot down here for the coordinator to take some notes. So some things that come out of that are they will identify different needs of their clients that then we can use to report back to the funder. So this is just one example of how we can use it. We actually use Google Forms for this client across 3 different projects. I won't share the other ones just because there's more information about their organization that I don't want to share today, but it's an easy form. It's easy to set up. It's easy for kind of anybody to access and use. Our clinician uses it. Our project coordinators, our certified peer support workers use it. So it allows everybody to just log in and kind of log their data there.
So Kelly, I have a question. I should know this, but I don't. so first of all, what does ROAD stand for?
Yes, it's resources, opportunities, advocacy, and diversion.
Okay. And then in that Google form, is the coordinate, like who's entering that data?
Great question. So their certified peer support worker who handles every harm reduction client interaction is the one entering that, as well as the administrative assistant who works with her.
Okay, so like there's a paper form, and then one of either the peer support or the admin is entering it in, and like after they see somebody every time.
Mm-hmm.
Okay, so you have 33 responses. So there's been 33 interactions.
Correct.
Okay. Cool. Any other questions or thoughts about Google Forms? Okay, Dr. Nick loves Google Forms. Yeah, I really appreciate you sharing that. I love that it's in real time and it's accessible. And I think it really makes the case for data like, oh, this is important. We know that, 50% of our clients are doing well, or, receive Narcan or whatever it is that you're collecting. So I really like that. Is that something you can share, that form, like a generic version of that, Kelly, or not?
Yeah, I probably can just create a copy and share a generic version. Absolutely.
Because that might be good and I'm thinking about myself, even like for anybody that's not creating forms all the time, sometimes it feels a little bit daunting. But if you have a form and you can just modify the questions, or even you copy some of your great questions, Kelly, then it's like a win-win. So, okay. Any other thoughts on that? I can't believe how quickly the 90 minutes is going. But we'll just keep on cruising then, and chime in as you feel called to do so. We also use Excel. There's an example of that is in the box. And again, it's just another way that you can think about managing and kind of organizing your data. I want to talk a little bit about data use and sustainability. And Kelly, your example with Google Forms and those visualizations was just really powerful because that's really data use right there. Another example that we have created or to show you is this data dashboard. And this was created in Tableau, which is an online visualization software program. And we actually didn't know if it was going to be worth the money. I'm just being real with you guys, because the subscription was like $1,000 for a year, I think, for Tableau. And then we had a team of kind of PhD consultants create it. And so that was like $10,000. And I think looking back, I don't know how many people are into this data dashboard, but we tried it out. We wanted to see, you know, what would this look like and would it be a good way to share information from our recovery program? So this example is some outcome data from CAM sessions that we offered with 2 of our locations in Wyoming for recovery participants. And it's pretty cool. Like, you can kind of interact with the data. You can see, you know, what different values mean. You can change it if you want to know how many acupuncturist sessions were attended, the average versus chiropractic and massage, etc. And then reasons for attending. So it's just one way to kind of interact with data. And I think I'm in academia, you know, it's like, oh yeah, this is great. Or if you work for like a county health department or a big program, but not sure about like RCOs or nonprofits, like what, if it's worth the investment. But it's an example and it's out there. Have any of you used a data dashboard? Any thoughts on that? Okay, ArcGIS is another good dashboard for Melissa.
Yeah, we use data dashboards, but it's not at the expense of the RCOs. It's something that our like state and third-party evaluators put together for their own use. The RCOs do benefit from it because they have access to it, obviously, but yeah, I don't think individually it would be something the RCOs would particularly invest in. But when you're working with as much data as we work with, and the state doesn't like reading through analytics report, they want a nice, pretty dashboard to look at of all the data that they require us to collect, but you know, can't read. They use a dashboard and they invested in that themselves. So we use ArcGIS though, but we do. There are other programs within the state that use Tableau. Both are good.
And I think we can't underestimate the power of dashboards as our recovery community organizations grow and we see more and more statewide recovery community organizations where the work being done one by one RCO impacts our work or those sorts of things. I think dashboards can be great tools internally to kind of see both where are we reaching and where aren't we reaching as a collaborative community or network of RCOs. And I know we use it a lot, again, at the Peer Recovery Center of Excellence. We use dashboards. So these 4 different teams that we're all in different geographic locations across the US. Even I live in St. Paul, Minnesota, but I work for the University of Wisconsin-Madison, and I do not commute every day. So how do we create things like dashboards can be really good tools for internal purposes as well, not just customer or stakeholder facing.
Yeah, wow, very good. Let's see here. One of the things we also wanted to talk, so yeah, with dashboards, I mean, there's a lot there. I think that once you have a data management plan in place and inventory, like you are on that train, then it's good to think about dashboards and kind of what the next step is, what that looks like. I know there's some free programs as well. So Steph said, I'm realizing that we are organically creating at our centers as we use our data. Okay, so Steph says they're organically creating those. You can do some things in Excel as well with data visualization. So Kelly, did you want to share anything from the residential treatment eval?
I don't think we need to. I know we talked a little bit about it last time, but that's just one example of how we used Qualtrics, and it's an ongoing residential treatment evaluation. So I guess I can briefly share what that is. So for our recovery center, once they send somebody to residential treatment, they have a 6-month out kind of outcome evaluation looking at client satisfaction with the center that they sent them to, because they're really trying to determine what partners are probably the most beneficial and the most impactful for their tribal members, because it is a tribe that we support for that one. So that's kind of an ongoing treatment evaluation where the clinical director, after sending somebody to residential treatment, has them follow up and complete this survey and receive an incentive in order for them to share some good feedback and information that they use formatively for their program. As well as kind of really understand what recovery outcomes they're seeing after treatment. That's something that's been really impactful for them in sharing with tribal leadership in order to get tribal leadership on board with paying for and supporting paying for residential treatment for clients.
I love that. And you really hit on something that's so important. It's at the core of data. Like in order to run programs, you have to have funding, and you get funding when you have data that tells a story about a need or something that's happening. And so it's like so basic and so necessary to have data. And it's just kind of figuring out like how to do that and what story you want the data to tell. Is another really important consideration. And I also wanted to just touch on.
I think Amber has a question.
Oh, yes, Amber, please ask away.
Not so much a question as just kind of a reminder that this data is invaluable both now and in the future for your organization, because as recovery centers, for instance, evolve and become more recognized as a solid profession, because there are those pockets in the nation that don't view it as such yet. As it becomes more recognized, we're going to have different data that the state or SAMHSA or whoever wants to collect. So if you're already doing your part and you're already collecting that data, you're going to be far and away ahead of the game when it comes time for granting or new grants or whatever.
Yeah, thank you for sharing that. I mean, that is really, it's like the guarantee that things will continue. And so having that in place and also establishing capacity and systems is really important. I know there's a whole section in SAMHSA grants that you have to kind of really outline your capacity to manage grant data and what that looks like. So thank you for sharing that. I'd love to have a volunteer, maybe somebody we haven't heard from today, somebody, you're feeling brave. Angela, I keep on seeing your video on, so I just naturally want to go to you. Angela, where are you calling in from?
From downstate Illinois, Belleville,
Okay.
Illinois, St. Clair County. And it's so funny because I'm learning out of this, and my organization does a lot of our data tracking. And so I'm learning it because in the future, I want to do an RCO. So I need the information because we just did an assessment and my supervisor did all of the data. So it was like when she gave it to us, it was already there. So it was like, it sort of takes the fun out of it, you know. So, but I'm nowhere near, I'm just a newbie. So I know nothing.
Well, not after today. After today, you are on your way to being a data management guru. But thank you for being here, and thanks for having your video on and just sharing kind of where you're at. I love your dream to create an RCO. We should talk about that offline. But yeah, I think the message is that, you know, the data is definitely essential, and it sustains programs, and you just got to have it. One of the things I thought about that I wanted to just add in thinking about our discussion today was kind of going back to what we talked about earlier, like who has access to data, what does data use, and what do those agreements look like? So we have a confidentiality and data use agreement that our team uses. And so basically, and this is something that Chris, we have available in, I think, the box if anybody is interested. But let's say you have a team of consultants and they're coming in and they're going to be looking at your data. It's really important to have something in place that outlines like how it will be used, what will happen if there's a breach of data, and getting a signature and a witness for that. So that's something that we do. I really encourage you to look at that or think about that if you're just starting out. I tried to delete all the names. I think I see a couple in there, but that's something that's really important. There's also a data security report we developed. We did this several years ago after a client wanted us to kind of look at their data and, you know, if it was secure and what our recommendations were. So we did this, and I wanted to share it because it had some good information about minimizing data security threats, storage, transmission, and all of those things. So that's something to check out. It's in the box, and Chris, I'm sure you can upload that if you want to. And this is something that you could use and copy for your own organization. I'd love to see that. So plagiarize away on this, it would be good. It could also be used as kind of a check just to see, okay, where are we at with our password policies and things like that. How to prevent data loss, some data definitions, and a physical data log example. And this might be something that could be useful if you're still working with paper data. And if you like this, you want a Word copy of this document, let me know. I'm sure we have it somewhere. Because sometimes the export function in PDF does not work that well. But our goal is to make sure that anything that we create is used and supports healing of individuals and nations.
Allison, I did want to recognize Jennifer has her hand up.
Oh, yes. I'm sorry, Jennifer. Yes. Please share.
Hi, everyone. Thank you. Actually, I don't have anything to share. I had a question about RCO and maybe talking offline, but I am actually in Angela's area in St. Clair County, Illinois. So would there be is there any rules or anything that says there can't be two RCOs in one area?
Nope.
Okay. All right. Excellent. It's been great. I missed the first one, but I won't miss the next one.
Well, we're glad that you're here, Jennifer. Yeah, I think there should be RCOs on every corner. So good thing there's not any laws about that yet. So yes, thank you for being here. And it looks like you want to talk offline about RCOs. So Chris is a wealth of knowledge and here to support you all. The next thing I just wanted to share was a data visualization best practice document that we developed with CDC funding for OD2A grants. But I just wanted to share it because I think it's worth sharing. And it gives you ideas about if you're going to be sharing data and that you've analyzed it, you want to report it out. Just some principles and best practices to keep in mind. So would love for you to check that out if you're interested. And let's see here. I think we're just winding down. I want to make sure that we have time for any final thoughts or questions. There's a couple of recommended readings. A couple of these Chris shared with us. We're preparing for today. We have a fun blog about data management on our website. Would love for you to check that out and just stay in touch. So anything else, Chris or Kelly?
I think just reiterating that all the sessions in the Nonprofit Basics series, so you're participating in the April sessions now, the sessions run January through August, are intended to be kind of teasers or ways to dip your toes into certain areas that really matter to nonprofits. And so you can reach back out to the Peer Recovery Center of Excellence at any time and submit a request for technical assistance. We cover a lot of areas beyond recovery community organization capacity building, so that's the area I oversee. We do a lot around workforce development for peer recovery specialists in the substance use disorder field, a lot of evidence-based practices and disseminating those to the recovery workforce. And a lot around integrating peer recovery specialists into all types of different settings. So we kind of cover a wide array of things. And then say, if you're interested, like my team really is ready, we want to go deep, we want to go wide with data management, and we have a ton of questions. You can put in a request through the center, and I connect you to wonderful folks like Allison and Kelly to walk alongside you in doing that work. And that comes at no cost to you. So it's so we're a SAMHSA funded training and technology transfer center. So definitely reach out, and there's lots of opportunities to engage. Kelly was kind enough to put up our end of session, let's see, evaluation. And I will try to put I'm going to put that link in the chat as well, so that you can just open it up and have it at the end of, once we close up our session for today. If you can go to the link and complete that short evaluation, that really helps us out. So it lets SAMHSA know how we're doing and if you found this information valuable. But I do want to close. Any thoughts, Allison and Kelly, for the group as we wind up our day?
Well, I just want to say thank you for joining. And I love all of your reasons for showing up and just the honesty of the group. And one of the things that somebody mentioned, I think it was Melanie before she left, but she was looking at that employee assessment. And she said, I love the question, are you where you want to be? Like, you know, and this was geared for people working in this recovery program. But I always think it's important to reflect on that in our lives and in our work, and know that if we're not where we want to be with data management or whatever we're doing, we can change that and work towards something new and different. And we're all here to help you do that. So thanks for being here.
Thank you, everyone. And hopefully you can join for our May sessions. In May, we'll be talking all about managing finances in nonprofit settings. So thank you, Kelly. Thank you, Allison. You're wonderful. Really appreciate your knowledge and sharing it with us. And thank you to everyone who spent some time with us here today.